The Centers for Disease Control and Prevention has released the list of 10 great global public health achievements of the first decade of the 21st century. In the past decade, the number of children under age 5 years who die annually has dropped by more than 2 million. This is mainly due to factors such as expanded immunization, supplementation, oral hydration therapy, and antibiotics. Over the last 10 years, roughly 2.5 million childhood deaths were prevented each year because of vaccination against diseases such as measles, polio, diphtheria, tetanus, and pertussis. Vaccination is one of the most cost-effective ways to advance global welfare, according to the CDC. Between 2000 and 2008, an additional 800 million people around the world gained access to better drinking water sources. An additional 570 million people gained access to improved sanitation. By 2009, the number of malaria cases around the world declined to 225 million, dropping by 19 million from 2005. The drop is due to expanded use of insecticide-laced bed nets and indoor residual spraying. The number of people infected with HIV has declined steadily in the past decade, in turn leading to a decline in AIDS-related deaths. Testing and counseling, blood safety, and antiretroviral therapy are the main contributors to the improvements. Since 1995, 45 million cases of tuberculosis have been cured and 6 million lives have been saved. To save even more lives, new tools for TB control are under development. Education and safe water practices have helped nearly eliminate guinea worm, the vector for one of 3 tropical diseases targeted by public health authorities in all but 4 countries. There were merely 1,800 cases of guinea worm disease reported in 2010, and according to the CDC, eradication is very likely by 2012. Today, 172 countries have adopted the World Health Tobacco Control Framework, and more countries are completing surveys as part of the global tobacco surveillance system. These findings can help countries track tobacco use and encourage tobacco cessation. The traffic-related mortalities have been declining around the globe due to efforts such as World Health Organization's plan to improve road safety. The largest declines were in Spain and Portugal. Since the mid-2000s, the international framework for preparedness and response have improved. The internet and other media for public health surveillance have expanded, and systems detecting the clusters of unusual disease respond faster. The CDC notes that given this progress, there is now a shift in causes of death from infectious to non-infectious diseases. By 2030, non-communicable diseases such as cardiovascular disease, diabetes, and cancer are expected to cause more than 75% of the world's deaths, regardless of a country's income.